COVID-19, the elephant in the room. What is that elephant? It's comorbidities. Comorbidities. You hear it, but then nobody ever talks more about it. So we hear about people with comorbidities have more issues with viruses and colds and flus and COVID-19 flu and so forth. Well, why don't we spend any more time with that? And that's what I want to talk about here. So comorbidities, what is that? It's morbidities, it's diseases, it's chronic illnesses. It's people already a sickened body that then have fewer defenses to fight off viruses that are around us all the time, one of them being COVID-19, right? So we don't talk about comorbidities because it's not going to make headline news. It's not going to make people lots of money. If we take people and we take the big four, if you will, heart disease, cancer, diabetes, Alzheimer's, and you take those and we put everybody on a diet, meaning all the healthy things, more on that in a moment, and we do all that so we knock down 70% of the heart disease and 95% of the cancer, and Alzheimer's is knocked down 50% and delayed by 15 years for most people, and type 2 diabetes is knocked down like 99%, right? If we do that, it's great for me to say what I just said. That would make headline news, but it's hard. It's hard to do those things, and it doesn't make anybody any money. So we're not motivated because it's hard. We're not motivated because it doesn't make anybody any money, and it won't make headlines right now, where a lot of the fear and scaring and so forth will make lots of headline news. So what I want to do is, about these comorbidities, I want to pull them into recent headlines that mention them, but they don't go any further. This show goes further. And this is the type of thing that I do in my office, is we try to make a little bit of change in my little corner of the world with a few people that might be interested in making some changes to improve their health with the days that they have on this planet. So that's what we're trying to do here. These are three pieces of news clips on NPR in the past 3 days. So starting with Weekend Edition Sunday on January 2nd of 2022. In this Weekend Edition Sunday program, there was one doctor that said, it might have been a researcher, I'm not sure. I tried to pull up the clip again to specifically find that out, and I'm sorry I didn't, but I can find it. For some, being fully vaccinated and boosted is not enough. For some. And what that person was indicating was somebody who's immunocompromised, somebody that has a comorbidity, there it is again. Sometimes when they're fully vaccinated and boosted, it's not enough. Why is it not enough? Because their body is already broken down. Not everybody can be helped by the program we're going to talk about in a moment, but that's another indication. Well, what isn't enough then? What would be enough? It would be my question to that person, if we could lengthen that news segment and start spending some time on that. On the next day, NPR Morning Edition on January 3rd of 2022. Of course, the ICU numbers were up, and this was an interview, a quick interview with Dr. Mark Boone, who's from the Houston Methodist Hospital in Texas. And the question to him was, what are the types of patients that are being administered to the ICU right now? And he says, one of them are immunocompromised patients. Immunocompromised patients. If I had the chance, I would say, okay, well, Dr. Boone, can you tell us about those immunocompromised patients? Does that include patients with comorbidities? Right. So what are those comorbidities? Oh, people with heart disease that have had it for a long time, and type 2 diabetes, and cancer, and Alzheimer's, dementia, and so on and so forth. Okay. Then I would ask, well, what can we do about that now as a collective we as a population? The stats on kids now, same news segment on January 3rd. Kids. There's been a 50% increase in hospitalizations. 50% increase in hospitalizations in the past couple of weeks from the uptick in COVID Omicron. But that number of kids in the hospital now is lower than the numbers of kids in the hospital from the previous variants. Okay? So that means, as we all know, with Omicron, it looks like so far, and of course from the data from South Africa, is it's super contagious. It goes quickly. It gets to people quickly, but it's not causing a lot of serious illness as much as the prior variants, and that will be a good thing. A little sidebar there. Then the segment today, January 4th of 2022. This is, again, NPR Morning Edition. What do new public health guidelines from the CDC that came out, which you're all, I'm sure, aware of, mean for your family? And they were interviewing Dr. Lena Wen, who is a public health professor at George Washington University. So the question was, the CDC isolation guides now went to 5 days instead of 10 days after you get a positive test. And then there's no retest needed before going back to, say, work. So Dr. Wen said, CDC is making the right move here. She says, we're facing a collapse of critical infrastructure. We're out of numbers for essential workers. We don't have enough police, firefighters, teachers, healthcare workers. I think this is the right move, she said, although we should have an option to test for returning to work. But now they're saying we don't have to. So she was saying in here, and I thought she did a good job, where she was saying as public health officials and making guidelines, it's not just on the science, she said. We have to blend in the other societal issues that are going on. And if we're running out of police and firefighters and healthcare workers and teachers, and we also know the data that somebody is more contagious in the first couple of days before you have symptoms and the first day or two after you get symptoms, that 4-day period, if you will, something like that. And then after that, you're not nearly as contagious, which has always been the case mostly with viruses. Then they're saying, give it 5 days and then get yourself back to work. You have to mask up, and we can cover that in another show. But she did say this is different from visiting grandma in a nursing home. Don't just rely on the 5 days. Make sure you are testing twice out of isolation when you're visiting the vulnerable population. That makes sense, even before our acute awareness of flu viruses since COVID-19. Seasonal flu viruses could kill up to 60,000 people in the United States per year, hundreds of thousands hospitalized with a great strain on the healthcare system, tens of millions sickened throughout a winter, but we never did anything about it. We never did anything. And seasonal flu viruses would rip through nursing homes, unfortunately, and long-term care facilities and so on and so forth. But it may be that in the past, the grandchild would have sniffles and go visit grandma in the nursing home, and who knows, that might have been the seasonal flu virus, and then it was brought in, and then bingo, bango, boingo, you know what might happen there, but we still kind of allowed that to happen. So what we're saying here is you kind of know better. Okay, if you have a positive test or you have the sniffles, stay away 10 days, maybe get a test before you go visit grandma in the nursing home. That makes sense to us. Okay, then there was another question. FDA authorized boosters for kids as young as 12, but if most vaccinated kids, this is the question now, but if most vaccinated kids get only mild or no symptoms, do they really need boosters? This is Dr. Wen. This is where I'm going to wrap it into the comorbidities. Okay, so we're coming back to that. You'll see that in just a second. We're coming back to that. I think there will be a lot of teens and parents of teens who want to get a booster. There are teens with asthma and obesity. Those are two specific things that she said. Asthma and obesity and other chronic medical conditions will get a booster as soon as it is available. We should allow those that want to prevent symptomatic infection to get the booster. Okay. So, what are we talking about here? So, we as a society, if we have these children and teenagers that have asthma and obesity and other chronic medical conditions, is this the best that we can do in the United States? Is this the best that we can do, that we can just say, these kids have asthma and obesity, they want to get boosted because they are already immunocompromised. They're already at a higher risk of having a more serious infection if they get exposed to a seasonal flu or COVID-19 flu or whatever it is. Is that the best that we can do, is just say, mask, vaccinate, isolate? Is that the best that we can do? In my office, in practice over 30 years now, I've taken children and adults with asthma and I make a nutrition tweak and their asthma goes away. I get them off of dairy products as an example. It doesn't work for everybody, but the people that try it, oftentimes it does. We knock out dairy products and all of a sudden, they don't need their asthma medication anymore. And I'm not saying do not take your asthma medication. You never do that. Never do that. Talk to your doctor. But what I'm getting at is I've seen natural ways of improving someone's health so they have fewer comorbidities, so they have a healthier life and a healthier future and a healthier immune system. Children with obesity, it's pretty darn rare to have some sort of a metabolic disorder that is causing obesity that can't be corrected by lifestyle, right? So if you read, I've talked about these books time and again on this show, if you read Dr. Robert Lustig, that pediatric endocrinologist in California with a specialty in childhood obesity, if you read his book, Fat Chance, if you read his book, Hacking of the American Mind, and he poses in the book Fat Chance, why do we have an epidemic of obese 6-month-olds? Because we're feeding them milkshakes in the form of formula with high fructose corn syrup. Why are we feeding kids these things? Why are we giving them soda early on and juice at whatever amount that they want? And we're sending them down that train of obesity, which then leads to comorbidities, which leads to a decreased immune response, which leads to more of a chance of having a more serious illness after being exposed to a virus, seasonal flu virus, COVID-19 virus, when it could be something preventable. Why don't we do that? Is that the best that we can do in the United States with the best healthcare system on the planet? We spend more money than anyone else. We spend more money per person than anyone else. We have the most talented people and the best science and more facilities and more doctors per person than anywhere else. Is this the best that we can do? I don't think so. As a practitioner, I think we can do better. But the stuff that I'm recommending here is, it's harder work. It's like, no, we're not having soda anymore, diet soda anymore, sport drinks anymore. We're not having these snacks out of a bag any longer. We're not snacking before we go to bed. We're not eating things that taste good all the time. We're not always getting fast food. I'm not saying all fast food is bad for you, but we're not always getting that food. We're going to take some time, and we're going to, as a nation, we're going to help improve and steer people in the right direction, including our children. Look at how important it is for the children, right? Is decreasing children's comorbidities now so they don't end up in that comorbidity bucket, that big bucket, as they get older with the heart disease. Because when you have obesity as a child, you increase your risk of heart disease and cancer and type 2 diabetes and Alzheimer's dementia down the road, making you have more comorbidities, making you more susceptible to seasonal flu viruses that are never going away. Who knows if this COVID-19 virus morphing whatever is going to ever go away. The viruses have been here forever. They're going to be here forever. So we need to relate to them better by having healthier bodies. That's what I'm suggesting here. So what do we do about it? We do the 7 things that I've talked about. And these are the things that I talk about in my little tiny chiropractic office that I have, that I'm just trying to make a little bit of a difference in myself and with anybody that wants to listen. And we talk about nutrition. Nutrition is the first thing. Number 2 is exercise. We just work on those 2. Imagine the things that we could change. Instead of just saying, oh, you've got some high blood pressure and some heart things, your cholesterol is a little bit high in your blood test. Here's a statin, stay on this forever, you'll be fine. We call that the best healthcare on the planet. Can we do better than that? I think we can if we just started saying, how about a little bit of nutrition improvement? How about a little bit of exercise? And then we can start getting into sleep and taking care of your spine and your nervous system and adding in chiropractic care, talking about stress, immune system building supplements, which we talked about in prior shows here just recently, and water. If we talk about all of these things and start working on this list of things, I think we can not make a small change. We could make a massive change on the number of chronic diseases, these chronic illnesses, the comorbidities that make us more susceptible to having more severe illness, or maybe even succumbing to seasonal flu, COVID-19 flu, cold viruses, whatever it may be. This is, I believe, the answer out of this. This is really going to take us out short term and long term, but the issue here is it's hard and it doesn't make anybody any money. And if all of a sudden I'm the health guru of the United States and I hire this amazing panel of all of these holistic medical physicians and nutritionists and naturopaths and physical therapists and chiropractors and acupuncturists and massage therapists and meditation people and holistic healers and whatever it is. And we create this massive panel of how we're going to change everything. We're going to completely shake up the system. Guess what? I'm dead in 24 hours. That's going to be another problem, okay? So I'm not around anymore to try to implement this list. So we've got issues here. This won't be easy. I'll give you an example too. If you read Dr. Dale Bredesen's book, The End of Alzheimer's, in there he has a program of trying to prevent Alzheimer's dementia, making your brain better, and taking people diagnosed with Alzheimer's dementia and making it better. Maybe you read Mary Newport's book on coconut ketones, on how she took her husband out of deep dementia for a while, just with coconut oil, but she makes other suggestions in there as well. But anyway, you take Dr. Dale Bredesen's program on the end of Alzheimer's. I have suggested that program directly to families, dozens and dozens of families that have had somebody diagnosed in their family with Alzheimer's dementia. And I've had one family out of dozens and dozens that I've mentioned to it actually do the program. They did the program, and sure enough, the woman that was diagnosed with it had measurable improvements in her brain. Measurable improvements, okay? But only one family did it because everybody else says, too hard, won't do it, too hard, won't do it, too hard, won't do it. Now I got it, I'm on their team, I'm on your team. There's no finger pointing here, okay? I'm not perfect either, okay? But I understand it's hard to do these things, but it's also really hard to have comorbidities. It's really hard to have a child that's growing up and then they're getting the asthma and the allergies and the chronic medical conditions and the obesity that we talked about earlier. That's pretty hard too. So we have to take a look at that and say, how about a little bit of prevention here? This could really, really work if we implement some of the things on this list here. We can make a change here and we can say, okay, COVID-19 viruses and all of these strains that will be coming out are going to probably be here forever. We know coronavirus strains have been around forever. They've been identified since we've been able to identify them. Seasonal flu viruses will be here. They always change every year. That's why you always heard the seasonal flu vaccine always changing. And with the best scientists and the best nation and the best time of history, the smartest people are between 10 and 60% accurate on making seasonal flu viruses good. That's how difficult it is. So the point is viruses are always going to be here. We just have to work on ourselves to create a better atmosphere here in ourselves as individuals so we can relate to the viruses better that are always going to be in our environment. I'm Dr. Scott Fuller.